Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about this fibrinogen blood test. So now that we are discussing about the acute phase reactant, fibrinogen is also one of the acute phase reactants. So I have included this test also in this series. It's also called as factor 1 activity test. So what is this fibrinogen test? So this test measures the level of this protein called as fibrinogen. Okay, so fibrinogen is a protein, and who makes this fibrinogen? As usual, our liver. Okay, and this fibrinogen helps the blood to clot. So if your body has low fibrinogen, it is difficult for the blood to clot. And suppose if you are having symptoms of excessive bleeding doesn't stop, there is a cut, there is excessive bleeding, etc., doctors might order this test, fibrinogen. So here you can see that this is a damaged blood vessels. You have a cut or something, injury, and the blood vessel integrity is broken. And here you can see that the platelets have come here to form a plug. They have come here and blocked it, and there is vasoconstriction which limits the blood flow, and here there is a development of the clot, and these are the fibrin stands. Okay, so whenever there is this blood vessel damage, the clotting factors are activated. So the prothrombin is converted into thrombin, and thrombin helps to convert fibrinogen to fibrin. Okay, so whenever there is an hemorrhage, there is platelet activation, there is clotting cascade which is initiated, and there is stabilization of these platelets and the clot. Once it is formed, the clot also has to be dissolved. So there is fibrinolytic system which comes into play. Okay, so there is a balance between the coagulation factors and also the fibrinolytic system to maintain the homeostasis. So this is the pathway, this is the intrinsic pathway, this is the extrinsic pathway, here you can see, and finally the fibrinogen getting converted into fibrin and insoluble fibrin. So I've told you that in acute injury, whenever the body is exposed to certain tissue damage or infections or trauma, few of the acute phase reactants are increased and few are decreased. So C-reactive protein, serum amyloid A, fibrinonectin, ferritin, your fibrinogen, these are the acute phase reactants which are increased. Okay. Whenever there is an inflammatory stimulus, it could be tissue injury, infection, heat, stress, there is activation of these monocytes and macrophages. There is release of cytokines from these leukocytes. Okay, so whenever this happens, the liver also produces certain proteins in order to fight, in order to stop these infection or tissue damage or stress. So that time the liver produces excess of these acute phase reactants like fibrinogen, hepatoglobulin, complement components, etc. And certain acute phase reactants are reduced like albumin, transferrin, etc. And these are also responsible for your systemic response, your tumor, Galler, Dollar. So you patients will have fever, patient will have muscle breakdown, patient can have hematological changes like leukocytosis, thrombocytosis, anemia. There might be certain biochemical changes. All this happens because of the mediators which are produced, and they try to limit the spread of that infection or tissue injury. So this is what the fibrinogen production, and this is how the fibrin clot looks like. So now when the doctors orders this fibrinogen test, I've told you when the patient is having bleeding symptom, he's having excessive bruising, the patient is having bleeding from his gums, there is frequent nosebleeds. So the doctor orders these tests to rule out any bleeding disorders. In certain liver disease, because liver is the one which produces most of this clotting factors and most of these proteins, whenever there is a liver dysfunction, there is Either the patient sometimes will have abnormal bleeding or there is change in these parameters. So in liver diseases, doctor's orders disseminated intravascular coagulation, that is consumption coagulopathy. Here to monitor if there is any serious blood clotting disorders, then the doctor orders. In pregnancy, sometimes what happens, patient has recurrent abortion or patient develop a complications like preeclampsia or abruptio placenta. That time doctors orders this fibrinogen test to monitor the patient during surgery, before surgery and after surgery. These tests are ordered. And suppose they get an abnormal coagulation test, the patient is having a high PT, aPTT, etc. At that time these tests might be ordered. And also to assess the risk of heart disease, stroke, etc., doctors orders this fibrinogen test. So what are the types of fibrinogen deficiency? So fibrinogen deficiency can be afibrinogenemia. That means there is no fibrinogen in your blood. This is very, very rare. 1 out of every 1 million people will have this, but yes, there is a condition called as afibrinogenemia. There is no fibrinogen at all. Second would be hypofibrinogenemia. When you have the fibrinogen but the quantity is less, that is called as hypofibrinogenemia. And dysfibrinogenemia, the fibrinogen is there but it doesn't function properly. So these are the different types of fibrinogen deficiency: afibrinogenemia, hypofibrinogenemia, and dysfibrinogenemia. So what is the normal level of this fibrinogen? So the normal level would be anything between 2 to 4 grams or 200 to 400 milligrams per deciliter. And the cost of this test would be something around 1200 to 1500. So this range of fibrinogen is considered normal. Now, what are the causes for high fibrinogen? I've told you that this fibrinogen is an acute phase reactant, isn't it? So whenever there is inflammation, if the patient is having any kind of an infection, if there was any tissue damage, injury, then the fibrinogen level will increase because the liver produces more proteins to stop that infection. If the patient is having a bacterial infection, the fibrinogen is increased to trap that bacteria. So the fibrinogen level increases. In cardiovascular disease, patient is having heart attack, stroke, these patients have increased fibrinogen level because there is a clot formation. So clot needs fibrin, isn't it? So fibrinogen level is also high. Pregnancy, yes, the body prepares for the childbirth, and in pregnancy there is natural tendency for the fibrinogen to rise so that there should not be an excessive bleeding, etc. So that is why in pregnancy the level of fibrinogen will be high. In smoking, okay, so tobacco is one factor which increases the fibrinogen level. So it is an hypercoagulable state and it is a risk factor for so many diseases. So smoking will increase your fibrinogen level and hence the risk of developing heart disease, stroke, heart attacks, etc. Obesity, overweight, these obese people tend to have a higher fibrinogen level. Okay, because obesity is a state of chronic low-grade inflammation. There is always a low-grade inflammation in them because there is stress on the body because of this excess weight. Hence, the fibrinogen level also is on the higher side. Your hormonal factors like your oral contraceptives, hormone replacement therapies can also increase the fibrinogen levels. That is why this is called as an hypercoagulable state, which can increase the risk of venous thromboembolism, blood clots, etc. The chances are very less, but yes, they can cause these complications, your OCPs, etc., because they increase the level of fibrinogen. Certain cancers like Hodgkin's lymphoma, that can elevate your fibrinogen. Your because what happens is there is a tumor driven inflammatory response. Because of this tumor, the body responds to this inflammation, and hence there will be increased level of fibrinogen, the risk of formation of clots, etc. Rheumatoid arthritis, certain autoimmune disease can increase the fibrinogen. Your diabetes, high cholesterol, that is also associated with increased fibrinogen. Okay, so I've told you that fibrinogen is an acute phase reactant. That means the protein the liver is going to produce in higher quantities to respond to the stress or to the inflammation or to the injury. Okay, so while it is necessary for the normal clotting process, abnormally high level of fibrinogen can increase the risk of developing dangerous clots. So I've told you the normal level is between 2 to 4 grams. Okay, suppose if it is very high, then there are chances that there is a risk of developing blood clots. Now, what are the causes for low fibrinogen level? One is inherited causes. There are certain genetic disorders where the fibrinogen, whatever is there, either it is not produced or produced in a very low quantity. Okay, so it doesn't function properly. Or it could be acquired disease, like a patient has a liver disease. Liver is the one which produces fibrinogen. So when the liver itself is damaged because of alcoholic liver disease, cirrhosis, the fibrinogen is produced less. Disseminated intravascular coagulation, there is consumption of all these clotting factors, so the level of fibrinogen also reduces. Severe bleeding, there is significant blood loss from trauma or surgery or childbirth, abruptio placenta, etc. So the body's fibrinogen is depleted to prevent this bleeding, hence the drop in the fibrinogen levels. Certain cancers, certain advanced cancers can cause consumption of fibrinogen. Okay, because what happens then, there will be small clots, etc., which are formed in these advanced cancers. So the fibrinogen of the body is used and there might be low fibrinogen. Severe infection, sepsis, that can lead to increased consumption of fibrinogen. The body is producing more and more fibrinogen to stop that infection, to stop that sepsis. And in the bargain, the fibrinogen is reduced. Pregnancy complication. The mother developed abruptio placenta, placenta previa, or stillbirth or infection. The fibrinogen levels get low because it is used to stop that bleeding. Okay, hence the level of fibrinogen goes down. Certain medications like streptokinase, anabolic steroids, valproic acid, phenobarbital, they can also lower the fibrinogen level. They can cause low fibrinogen mainly by affecting the liver synthesis of fibrinogen and increasing the activity of the fibrinolytic system, which will break down these clots. Hence, the level of fibrinogen will go down. So, these were few points about the fibrinogen. It is not only an acute phase reactant but also an important factor which helps to maintain the clotting system in check. Okay, so to form a clot, to prevent bleeding, fibrinogen plays a very important role. Okay, so that was all about fibrinogen test. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.